Unfortunately, many people staying at home the last few months have been doing so while suffering from debilitating joint pain with no real way to get the treatment they need. As the country begins to reopen again, many people are turning to stem cell therapy instead of surgery or medications as a way to treat their joint pain. This morning, we are joined by Dr. James Altizer of NeoGenix. Dr. Altizer, thank you so much for talking with us this morning.
Good morning, Colleen. Thanks for having me.
Let's start with this. What exactly is stem cell therapy, and why are so many people who are suffering from pain turning to this over medications or surgery?
Well, in the past, all the therapies we had for arthritis just covered up the pain. Cortisone shots, gel shots, pain creams, pain medications like naproxen and Motrin and ibuprofen. None of those therapies actually healed the damaged tissue or changed the natural course of arthritis, did anything to slow it down. Stem cells are a revolutionary treatment for arthritis that I think can actually slow down the course of arthritis, and they can actually heal the damage caused by time and gravity and wear and tear on your joints.
So what kinds of conditions are you able to treat with stem cell therapy?
Well, obviously the most common ones would be knee pain, low back pain, shoulder issues. We can do partial tears of rotator cuffs, Achilles tendon strains, patella tendon strains, golfer's elbow, tennis elbow, sacroiliac pain, sciatica, lumbago. But the most common things we do are knees and shoulders and backs. But I've done wrists, thumbs, fingers, ankles, hips are very common. So pretty much any joint that you can reach with an injection, you can treat with stem cells.
I was going to say that pretty much covers the entire body, anywhere you might.
There's only a few joints that I don't do.
Wow, that's really incredible. Okay, you have what you call a 5-step treatment process to become pain-free. Can you walk us through those 5 steps?
Absolutely. This is a protocol that I came up with after working with thousands of patients over the last 4.5 years. So step 1 is preparing the joint with a special injection. And what that does is it calms down the inflammation in the joint and makes the joint more hospitable for the stem cells to work. An inflamed arthritic joint is a very toxic environment. So if you dump stem cells into an inflamed joint, the thinking is the stem cells won't work as well. So what we do is we do an injection to calm down the inflammation in the joint. And then a week or 2 later, then we do step 2, which is the actual stem cell injection itself. And the stem cells come from the patient themselves, not from anybody else. It's from the patient. And that's the best place to get them. Step 3 is bracing the joint, such as a knee especially with cartilage in a knee that's worn out. The joint is not functioning properly. The anatomy is thrown off. So you have to use a joint brace to allow the joint to function properly. Step 4 is rehabilitation. And they've already done studies to show that rehabilitation combined with stem cells works better than doing either one alone. So why wouldn't you do both? I want to get my patients pain-free and back to their normal lives as quickly as possible. So it makes sense to me to follow the literature and combine rehab with stem cells. And step 5 is a booster shot done 6 to 8 weeks after the stem cells of PRP, which is growth factors. Again, this comes from the patient. And this just kind of kicks the stem cells in the butt a little bit, if you will, and gets them to work a little faster and gets the patient back to being pain-free a little more quickly. So these 5 steps I came up with, and in my experience, they seem to work the best at getting people out of pain and back to living their normal lives.
And you have a lot of experience with this. You've treated literally hundreds and hundreds of patients over the years.
Several thousand, yes. Since January of 2016, yes. Several thousand patients. So,
my goodness.
Yeah, I think I've done more than anyone else in the area.
That is incredible. That is incredible. So how can people who are listening out there take that first step and request a consultation with you and your team?
They can look at our website. There's a lot of information on our website. We have a really good frequently asked questions section that goes into a lot of detail about different conditions that we treat and how we treat them and the different levels of stem cell and regenerative medicine therapy. That's neogenixstemcells.com. They can give us a call. The consultation is complimentary. we're filling up. So, with the virus restrictions, it was a little slow, but now we are jam-packed. So you've got to call and get in here for the complimentary consultation, and you'll never know unless you come in and find out. If you've been told that you might need surgery someday for arthritis, for a joint replacement, you really owe it to yourself to give stem cells a try before you submit to a last resort like surgery.
Also, we should mention that you are offering today to the first 20 callers, they can get step 1 of that 5-step treatment process for free to the first 20 callers. This is the number for NeoGenix, 704-727-6551. Again, 704-727-6551. And again, as Dr. A mentioned, the website, neogenixstemcells.com, neogenixstemcells.com. Dr. Altizer, thank you so much for your time. It's great to see you.
Thanks, Colleen. Good to see you too.